Welcome to On the Right Side of History with Kansans for Life. Come with us as we connect the pro-life movement's past to present, uncover hidden or forgotten history, and its connections to the battle still raging today. Now, here's our host, Danielle Underwood.
Hi, everyone, and welcome. Today, board-certified OBGYN Dr. Christina Francis joins me on the podcast. Dr. Francis is CEO of AAPLOG, the American Association of Pro-Life Obstetricians and Gynecologists. She's practiced obstetrics since 2009, is an associate scholar with the Charlotte Lozier Institute, and a physician member of the Abortion Pill Reversal Network, which assists women who seek help to save their babies after taking the first pill in the chemical abortion process. She speaks and writes on women's health issues and has been published in the Wall Street Journal, Newsweek, and USA Today. Welcome, Dr. Francis.
Thank you so much for having me. It's so great to be with you today.
It's so great to have you. It's so wonderful to see you again and just to reconnect. I've been following your work and just, it's amazing. First of all, just the sheer amount of energy that you pour into this pro-life movement. And we are just really grateful to have your voice speaking on behalf of mothers and preborn babies. So very grateful to have you here today. So I wanted to just kind of launch our conversation by talking specifically about AAPLOG. And I understand that AAPLOG has been involved in every Supreme Court case since Roe versus Wade, including Roe and Dobbs v. Jackson, which overturned it. That is quite a legacy. It's been around since 1973. Is that right?
Yeah, absolutely. As you said, we're a 51-year-old organization now, and we were started in 1973, really related to the Roe and Doe cases. And so we started as a special interest group within AAPLOG, the American College of OBGYNs, who many people have probably heard of. They are the largest professional medical organization representing OBs in the country. And, we started within them because many members within AAPLOG saw the leadership of AAPLOG starting to move in a very pro-abortion direction, which was really out of step with where the majority of their membership was. That previous to that, their position, AAPLOG's position really had been that elective abortion doesn't belong in the practice of OB, that really only what they called then therapeutic abortions, or what we would say a medically indicated separation of mom and baby for maybe a life-threatening condition, something like that. Their position really was that that's the only thing that should be a part of the practice of obstetrics. And so then when they started to move very much in support of elective abortions, several members within AAPLOG who had previously been in leadership said, this is not consistent with how we practice. And so they wanted to make that known within AAPLOG. And so they started a pro-life special interest group within AAPLOG. And that special interest group did submit what's called an amicus brief, or a friend of the court brief, with more information to the court in the Roe case. And then AAPLOG was officially started. So, and since then, as you said, we have submitted amicus briefs in every major abortion and conscience-related case at the Supreme Court over the last 50 years. And we're certainly very privileged and honored to have written what I think was a very important brief for the Dobbs case that, as you said, led to the overturning of Roe.
Yeah. So I think that it is, the voices of medical professionals are such an essential piece of the pro-life movement. And I'm just wondering your thoughts on why it's important for medical professionals to be leading voices in this debate surrounding abortion, including all the way to the U.S. Supreme Court.
Yeah, absolutely. Well, I think it's always been important for us to be involved in this, partly because our duty as physicians, we took an oath to protect our patients, and we know that induced abortion causes harm to both of our patients. Certainly our fetal patients have their lives ended by induced abortion, but also our maternal patients are significantly harmed. And we've seen this over the course of the last 5 decades in the US. When we've had unrestricted access to abortion, we've seen an increasing toll on women's mental health We've seen, increasing rates of preterm birth, which we know are related to surgical abortions, or we know that surgical abortions cause an increased risk of preterm birth in future pregnancies for women. And just, many, many other immediate complications that I know many medical professionals listening to this podcast have probably seen in their emergency room, whether it be, a perforated uterus or significant hemorrhage, just all those harms that we see caused to women by induced abortion. So I think it's important, one, that we have a voice because we're the ones managing the complications. We're the ones seeing women that are being harmed by this. But also it's important, especially since Dobbs, I think for one, I don't know about you, Danielle, but I guess maybe not prepared for the medical profession participating in such an overwhelming way in the lies and the misinformation that have been spread since the Dobbs decision. Lies that women are going to die without access to induced abortion, or lies about miscarriage treatment or treatment of ectopic pregnancy being the same thing as induced abortion. And so, while our colleagues on the ground, the pro-life grassroots activists are so important in this movement and helping to change hearts and minds, I just don't think there is anything that compares to having a physician counteract the lies of, unfortunately, other physicians, other medical organizations, things like that in this fight against, to protect our patients. And so I think it's extremely important that physicians and other medical professionals be involved in general in the pro-life movement, especially now that we've got this battleground on 51 fronts now, in all of the states, but also at the court. It's so important. So one of the reasons why AAPLOG exists is to be a second medical opinion to the courts, whether that be at the Supreme Court level or at state court levels, because, justices, judges, they're not physicians, they're not medical professionals. And so if they're only hearing one medical perspective, if they're only hearing from ACOG, for example, that abortion should be available with no restrictions and no regulations, and that that's completely safe for women, we all know that that's not true. And so they need to hear a second medical opinion. And when we do that, when we serve as that second medical opinion, it helps the judges to be able to take pause and look at the merits of what both sides are saying and realize that this is not a consensus of the medical community as far as abortion being quote unquote healthcare, but that there is in fact another medical opinion out there that is based in medical evidence. And so it's so important that we continue to show up and be that second medical opinion in the court, so that hopefully the judges and at the Supreme Court, the justices can make correct decisions that will support our patients better.
And that makes so much sense too, what you're saying. When I think about, I know from reading more about your work, 90% of obstetricians do not perform abortions. That is, a huge majority. It's more than a super majority. And I think, it is crucial that you all are out there to make sure that voice is being represented. So thank you again for everything that you're doing. So with so much that's happening right now, I think you all are involved. Are there 3 cases that are currently that you're involved in right now at the Supreme Court level, or are there 2?
Yeah, so there's 2, but 3 cases that are potentially impacted. So
okay.
There's a lot going on right now, certainly in this world, and even sometimes it becomes difficult for me to keep track of, actually, because there's so much going on. One of the biggest cases that we're involved in, and one that I'm certain that everyone listening has heard of, is the Alliance for Hippocratic Medicine versus the FDA. Actually, when it went to the Supreme Court, it was flip-flopped. It was the FDA versus Alliance for Hippocratic Medicine, but we also, AAPLOG, are one of the 4 medical organization plaintiffs in that case, and then there are 4 individual physicians, actually, who are plaintiffs in that case as well. And that is our case against the FDA over its unlawful actions in removing essential safeguards for women from how the abortion drugs are dispensed. And so that case, oral arguments were heard at the end of March at the Supreme Court, and we're currently waiting on a decision in that case. And then just about a month later, another case from the state of Idaho was heard at the Supreme Court over, actually the Biden administration sued the state of Idaho over their abortion law, which is a very good law that protects women and children in their state very well, but definitely allows for intervention by physicians when a woman is facing a life-threatening complication of her pregnancy. But the Biden administration tried to say that a regulation called EMTALA, or the Emergency Medical Treatment and Leave Act, which many people might have heard of, that act was put into place to prevent hospitals from refusing to care for patients who did not have insurance, for example, or refusing to provide stabilizing treatment to a patient that they might need to later transfer to a higher level facility. The Biden administration tried to say that that regulation means that emergency room physicians and OB hospitalists like me would have to perform elective abortions in the emergency room, saying that they were quote unquote stabilizing treatment. And so they sued the state of Idaho over their law, and Idaho appealed that up to the Supreme Court. And we, AAPLOG, wrote an amicus brief in support of the state of Idaho for that case. The reason I say it impacts a third case is because we also are a plaintiff on a case out of the state of Texas, along with the state of Texas, over this same issue of the Biden administration trying to use EMTALA to force our members to perform abortions in emergency rooms. And so that case is, we won a preliminary injunction, thankfully. Unfortunately, that protection under that preliminary injunction only applies to the plaintiffs in that case. So it only applies to physicians who are members of the organizations that were plaintiffs in that case, as well as physicians in the state of Texas. And so, you know, I'm not a lawyer, so I'm not going to say how the Idaho case could potentially impact that case, but certainly there's you know, I think there will be an impact depending on the justice's decision in that. So very big cases that impact not only our patients and how they're hopefully protected from harm, but also our physician members, you know, and other medical professionals in whether or not their conscience rights will be protected.
Yeah, that's what I was thinking. It really does affect the individual practitioner, the individual doctor, that medical professional who's there to assist these patients. And it's scary to think that they could potentially be forced to do something so very contrary to their foundational beliefs. So
and
much
Danielle,
is at stake.
if I could just add one more thing on that too, because I was doing another podcast just sort of about the conscience issue recently, and the person that I was speaking with brought up a very good point, and I think it's an important point to make, that, you know, oftentimes I think when we talk about conscience rights for physicians, I think polls show in general the American public is very supportive of that physicians should not be forced to do things that violate their conscience. But that doesn't just impact the individual physicians or physician assistants or pharmacists or, you know, whomever may be impacted by having to violate their own conscience. It also impacts the general public. It impacts patients who want pro-life physicians, who want pro-life midwives, who want pro-life pharmacists. But it also impacts the general public. You know, we see a dearth of obstetric providers across the country. We have maternal health care deserts across the country. I'm sure in a state like Kansas, there are pockets of Kansas that probably don't have good access to good prenatal care, good obstetric care. And if we start actively pushing out of medicine anyone who refuses to participate in death as a part of their medical practice, not only are patients seeking pro-life physicians going to be impacted, but every patient across the country is going to be impacted. It's going to be even harder for them to find the medical care that they need. And so I think that that's an important point to make of why the general public should actually care about doctors and other medical professionals not being forced to violate their consciences.
That is such an excellent point. You are right. You really are. That's that's scary to think about people not wanting to enter the profession because they're afraid that they're going to be asked or told to do things that are so against what they believe. We want those people to want to go into medicine. We need excellent medical providers. So thank you for bringing that up. So the first case that you mentioned that is specifically revolving around chemical abortion and the whole process that the FDA, you know, they skipped over lots of safeguards, or they, you know, very quickly remove safeguards. So much is involved in that. But, you know, here in Kansas, Our most recent state statistics that were released about a year ago showed that about 60% of abortions here are being performed by chemical abortion. It's likely much higher now. We've had some more things be relaxed, more laws be enjoined or overturned. So we're now looking at this very prevalent use of chemical abortion in our state. And I'm just wondering if you could explain for people who are not familiar with the process that the chemical abortion takes. Could you explain the effects of those pills on both the preborn baby and also the effects that they have on the mother?
Absolutely. So when we talk about chemical abortion, we're actually referring to a two-drug process. And I think it's important for people to understand because many people confuse this. We're not talking about Plan B or the morning after pill or emergency contraception. Those are very different things. What we're talking about are two very specific drugs. The first one is called mifepristone. The brand name for that is Mifeprex. And that drug actually interferes with the hormone progesterone, which many people have probably heard of. That's a key hormone in early pregnancy that leads to basically good communication between mom and baby. What that communication allows for is the flow of oxygen and nutrients to that developing baby so that he or she can grow in a healthy manner. So what mifepristone does is it blocks the ability of progesterone to have the action that it needs to have, and then leads essentially to starvation and suffocation of that developing baby. And that's what leads to that baby's death in most circumstances. And then 24 to 48 hours later, the woman takes a second drug called misoprostol. Some people might have heard of that. We actually use it in much smaller doses for term pregnancies, for induction of labor, but it's used for the chemical abortion process at a larger dose to essentially do the same thing, though, induce labor. And so it makes the woman's uterus contract, and then that leads to expulsion of her baby and the placenta, if the placenta has started to develop, if she's far enough along for that, and any other pregnancy-related tissues. So that's sort of the, the nuts and bolts of the mechanism of how these drugs work. But I think beyond that, it's important for people to understand, one, obviously it has a devastating effect for that child, leads to their death through, I would say a death by starvation is a pretty gruesome and awful death. But also the impact that it has on mom. So, we know the immediate complications, they can have really heavy bleeding. Oftentimes women are told, oh, it's just like a heavy period. But if you listen to the stories of women who have been through chemical abortions, what they report is something much, much worse. Very heavy bleeding, really horrendous pain, women describing feeling like they were dying. In fact, that's something that you hear very often come up when women are telling their stories, that they thought they were going to die. And then also delivering their babies, and their babies that they can recognize as a baby. And many women have told me, and I know many others that I have spoken with, that they were not told that that was a possibility. They were told that you're just going to pass some tissue and that's it. Then she's left wondering, now what? Now what do I do with my baby? And so that is I think the real impact that these have on women in the immediate term. And in fact, when the FDA approved these drugs for this purpose in the year 2000, they recognized these inherent risks, many of these inherent risks with these drugs. Another significant risk is actually infection, and very significant infection. And so they recognized that these drugs were risky at their baseline. And that's why they put into place a system of safeguards to try and minimize those risks to women when they take these drugs. And so some of those safeguards included that they could only be taken through 7 weeks of pregnancy, because after that, the risk started to increase significantly, that a physician would have to dispense them, and that a woman would have to have 3 in-person visits, one before she took the drug so that they could be sure she didn't have an ectopic pregnancy, which is life-threatening, or that they could ensure they knew exactly how far along she was when she was taking these drugs, but then 2 follow-up visits to ensure that her abortion was in fact complete, and that if she was having any complications related to taking these drugs, that those could be dealt with in a timely fashion.
And I think I remember seeing, is it CDC data that says that, or maybe it's FDA data, that 25% of women who take the chemical abortion pill end up having to go to an emergency room afterwards for follow-up care because of complications that they're suffering. Is that correct?
So one in 25 women,
One in
yes,
25. Oh, sorry. Thank you.
that's
That's a
okay,
big
that's okay.
difference. Yeah, thank you for
That's all
correcting
right,
that.
but still a significant number. So,
Yes.
and I think it's important for people to remember that's not our number. That's not AAPLOG's number. That's not a pro-life researcher's number. That's the FDA's own number. That 1 in 25 women will need to go to the emergency room due to concerns or complications related to this drug. And that's at the baseline. That's when all of those safeguards were in place. So that's under the quote unquote best circumstances, 1 in 25 women. Guttmacher put out their 2023 abortion statistics recently that showed that 63% of abortions in the US last year were done via these drugs. So similar to Kansas's numbers. So when you then look at the number of those that were, the number of total abortions that were chemical abortions, and then apply that complication statistic to it, that 1 in 25 women will go to the emergency room. That equals 25,000 women in the US last year that would have been expected to go to the emergency room. That's a huge number.
Shocking.
That's 25,000 women with significant hemorrhage or needing emergency surgery or being in such severe pain that they can't do it from home, or potentially having, severe mental health complications related to their abortion procedure. So I think it's just important for us to remember that number. Sometimes 1 in 25, at least to me, can sound a little, well, that's still a significant number, but
very high.
To really, truly realize the impact, 25,000 women, that doesn't sound like a safe drug to me. And this is something that I think, all people across the country, regardless of where they stand on the issue of abortion, whether they are pro-choice or pro-life, we all should care about the fact that 25,000 women, I think probably at a minimum, likely went to the emergency room last year because of complications related to these drugs. And again, remembering that 1 in 25 statistic is under the best of circumstances when those safeguards were in place, which of course now they're not, which was, what precipitated our lawsuit against the FDA.
And now we have, we're seeing even pharmacies, corner pharmacies, that are wanting to dispense these. And we're also seeing the Biden administration pushing for mail order distribution of this drug. And it's crazy to think about the lack of safeguards for women and how they don't seem to care about these true present risks that we've got to be aware of, and absolutely making sure that there are safeguards in place. There's so much that needs to be followed up on so many fronts of that discussion. But thank you for explaining so much about the mechanisms at work, and also, just how the people around, how pro-lifers can become more aware of what we need to know and explain to others who may not be aware of this yet. So thank you for that. Yeah, so
absolutely.
I'd love to, unless you have something else you wanted to add to that.
Well, the last thing I was going to add was just because I think for some people, maybe they weren't sure exactly what the case at the Supreme Court was about, or what was being heard. But I think the final point that I would make is that, we are asking the Supreme Court to have the FDA put back into place their original safeguards. And the reason why that's so important is because right now, as you said, these can be given out at your local pharmacy, or women, even young girls, can just go online and order these high-risk drugs without any supervision from a medical professional, putting them at risk for so many things: an undiagnosed ectopic pregnancy, which could kill them, or taking these drugs farther along in pregnancy when we know up to 1 in 3 women might need an emergency surgery to complete their abortion, or not even screening for coercion. What about the young girl whose older boyfriend is pressuring her to do this? We should all agree that this is not good for women and girls, and we are simply asking the Supreme Court to put back into place these common sense safeguards that were in place for 16 years, and the FDA acknowledged they were needed in order to reduce the risk to women. And so I want people to understand that that's, when they hear the decision that will come out probably sometime this summer, that's what's at question here in front of the Supreme Court. And again, this is really something that there's so many things in this country right now, especially over the issue of abortion that divide us, this is something that should unite us. That women deserve better than that. They deserve better than that kind of negligent care.
Wonderful point. Yes. Okay, so switching gears a little bit, I would love to go back to doctors again and medical professionals. And I know that, so you, as the leader of AAPLOG, you're working with a lot of doctors who are, they want to be connected to other doctors who are pro-life. They want to have that camaraderie. They want to have that connection to other doctors. And also, I'm sure that you're getting a lot of information that you're able to share with each other, all kinds of things that you all do. So I'm wondering, the doctors who are practicing out in the medical field now, and medical students too, who are in medical school, what kind of pressures are they facing from groups like ACOG or just from the medical schools, if they do begin speaking up for preborn babies, for the human rights of this very important set of patients, that if they're training to be an obstetrician, they're training to safely deliver these babies. So what kinds of pressures are they facing and experiencing?
Yeah, well, they're facing significant pressure and sort of I guess I would say many times a silent coercion, sometimes a not so silent coercion. But as you said, Danielle, one of the challenges and the joys of this specialty of obstetrics is that we're taking care of two patients at once. And it is heartbreaking to me that any medical professional would ever feel that they can't speak up for any of their patients. But certainly, many are being made to feel that they can't speak up for their preborn patients. There's a couple different ways that that's happening, that we can really put our finger on. I think that there's a lot that's going on where it is just this sort of culture that if you speak up publicly as pro-life, your job is very definitely going to be in jeopardy. But the two things that I can really definitely put my finger on are, first of all, the changes that have gone on at a training level. So end of 2018, early 2019, the accrediting body for all medical training programs, it's called ACGME. It's a private company, but it's the only one that accredits medical training programs. They switched their requirements for abortion training and obstetric programs from being opt-in, which is what it was when I was in training, meaning if you want abortion training, you can opt into that, and your program would need to provide some kind of avenue for you to get that training. And under that regime, at least where I trained, hardly anyone opted into that because we recognized that it was not an essential part of our practice. Now they've switched it to opt out. One little tiny word, but it makes a world of difference. That means that now abortion training is considered standard part of obstetric training. And if you, as the lowly medical student or the lowly intern, anyone who's been through medical training understands what that totem pole is like, you have to have the courage and the boldness to stand up and say, I know this is considered standard training, but I don't want to do it. And we have stories from medical students, from residents who have done that, who then have faced a much harder call schedule or had to come up with their own curriculum, spending hours and hours on top of the 80 hours a week they're already working, coming up with their own curriculum. So you can see that this is a very coercive environment that it sets up, that people oftentimes just sort of go along to get along. They sort of squash their objections. And first of all, no one should be made to do that. But second of all, I do think that that leads to then more acceptance of this practice that does not belong in our specialty. And it also sets up this very false narrative, as you said at the top. 90+% of OBs don't do abortions as part of their practice. It's not essential women's healthcare, and yet trainees are being made to feel that it is. So that's how they're getting to them, during the training process, and why we know that there are pro-life medical students that are just not going into OB because they don't want to be in that kind of situation. And then once you're out in practice, it doesn't stop. So right after the Dobbs decision, our board certification entity, the American Board of OBGYNs, issued a statement. First, they issued a statement that the Dobbs decision was detrimental to our patients' health and that abortion is essential health care. Then a couple weeks later, they followed that up with a statement to all board certified OBGYNs saying that if any of their board diplomats were found to be spreading mis or disinformation about abortion or any other essential healthcare services, that their board certification could come under review. That was huge. And it had a massive chilling effect on many, many physicians to be able to speak up for what they knew to be right for their patients. Because if I, as an OBGYN, lose my board certification, my career is over. I will not be able to practice at a hospital. I won't be able to find a medical group that will hire me. That will be a permanent mark on my record, even if it's able to be reinstated at some point in time. And so they wanted it to shut people up. And in fact, that's what it did, unfortunately, for many people. And I understand why people were scared. And so, what we're trying to do is to say, this is not misinformation. Everything that we say is evidence-based, and we should be allowed to speak up for our patients. And so those are the pressures that physicians and medical students are facing right now.
And all the more reason why AAPLOG is such an essential organization. To be
Absolutely.
uniting you all and staying rooted in that science, I think is so smart. So then what do you recommend to young medical students and others, maybe even midstream professionals, about how to become more educated in the pro-life science, the science that does back up our positions, and all that medical research that does bear out what you're saying? And also how to become stronger pro-life advocates. What are you recommending to them to combat? I mean, obviously, if you're drawn to become a medical professional, you have a mission. You have a sense of mission. It's a huge undertaking to go through all of the educational process that you all do. So I think you do have to be drawn to it for the love of the profession. So if they're being attracted to that and they want that, and they want to make sure that they stay a strong pro-life advocate, what do you recommend to them?
Absolutely. Well, the first thing I would say to a student who's considering OB and is pro-life, I would say 100%, we need you in this specialty. So please don't be deterred, and please know that we are here defending you, defending your right to learn medicine in a way that respects the lives of your patients, and also to practice medicine in the same way. But also, I would say to come alongside of AAPLOG, because we are here to support, as you said, not only medical professionals, physicians in training, but also once people get into practice. And one of the best ways that we do that is through our annual conference. And we just had someone come for the first time this past February to our conference and said, I feel like I could breathe for the first time in a very long time being at this conference, because I'm surrounded by like-minded medical professionals, and I'm learning medical evidence to support my practice in ways that I've never learned before. And it just feels so nice to know that I'm not alone. And so that would be one of my biggest things that I would say to anyone out there who feels very alone is, that's a very sort of easy way, I guess, that you don't really have to put yourself out there in public, but just come to our conference. You'll learn so much. It's so great to be surrounded by people who are, like I said, are like-minded, who believe the same things you do and practice in the same way that you do. We also offer scholarships to medical students who want to come, that provides all of their costs and allows them to attend. So that's a wonderful, wonderful way. People can go to our website to find out all of the evidence to support their life-affirming practice. But then finally, we also offer trainings throughout the country, and we're hoping to do one in Kansas City sometime this year. Trainings throughout the country that just help empower physicians and other medical professionals with the tools that they need to engage in the public square on the issue of abortion. Our position is you already have the expertise that you need. You really don't need any more expertise. Sometimes it's just a little bit intimidating, I think, to talk to the media or to testify at your state legislature, or maybe to be involved in a court process somehow to support our life-affirming practice. But you have all the expertise that you need. You just need a few tools to help empower you to feel a little bit more comfortable. I was in that position just a few short years ago. But I was able to learn some tools that helped me. And so we provide these day-long trainings free of charge for physicians and other medical professionals to be able to come. It gives you a great chance to get to know us as an organization, but also gives you a great chance, I think, to feel empowered, because we need your voices in the public square to be defending not only our practice of life-affirming medicine, but to be defending our patients as well.
That's perfect. And we have some wonderful pro-life medical professionals, some wonderful physicians in Kansas that I know who have been involved directly with AAPLOG. Dr. Lisa Gilbert, I believe, is on your board. And we have some other wonderful physicians who have consistently stepped up to offer testimony at our legislature, kind of doing some of the same things that you've said, giving that alternative medical perspective, all rooted in medical research and, all based on the facts, but making sure that decision makers have access to that information. And that's so critical. And really that the general public has access to it too. We need your voices. And I'm so grateful for everything you're doing. So if people want to follow you and your work, where are the best places for them to do that?
Absolutely. Well, I would say the best place they can go is to our website, which is AAPLOG.org. We have a lot of resources. In fact, under our resources tab, you can find practice guidelines, committee opinions, all fully sourced. We have videos available there as well, and lots of other resources for you. You can also follow us on social media. We're either American Association of Pro-Life OBGYNs or AAPLOG, AAPLOG on social media. We're on Instagram, X, Facebook, LinkedIn. We also have a podcast series, which I would highly encourage. I think it's helpful for non-medical professionals, but also for medical professionals. It's called Caring for Both, a curbside consult series. And we started it because, as any medical professional listening knows, oftentimes you don't want to do a formal consult on a patient. We just grab a colleague and do what we call a curbside consult, where you're just asking them a question and getting their thoughts. And so we started this as a brief podcast. There are 15 to 20 minute episodes that you can listen to going to work or coming home from work. And we address many of the ethical issues that we face as pro-life physicians and talk through with experts, how do we deal with that in our practice? And so I think it's a really helpful podcast series and a good way to get to know some of the resources that we can provide for you. And that can be found on YouTube or on any of the major podcast apps.
Perfect. Thank you so much. And so on behalf of Kansans for Life, thank you, Dr. Francis, for joining us here today. We really appreciate everything you're doing in the fight for protecting both the mothers and the preborn babies. You really are a warrior out there, and we're very grateful for all of that. So thank you for joining us today.
Thank you so much for having me, Danielle. It was great.
And thanks to all of you listening today. You can help us spread the word by sharing this podcast, and be sure to go and hit subscribe so you'll be notified of upcoming episodes. We've got more great conversations coming your way. Stay connected with Kansans for Life by visiting kfl.org and signing up to receive our updates. You can also follow us on Facebook, Instagram, X, and TikTok at Kansans for Life. And as we say goodbye, never forget, the pro-life movement is on the right side of history. Truth always wins in the end. We hope you'll join us next time. Thank you.